question for you. What's the difference between your basic in-and-out LASIK surgery and the PRK and the corneoplasty and things of this nature?
As you know, Jordan, LASIK is one among many laser vision techniques. Laser vision techniques do nothing more than shape your front of the eye, the cornea, with a laser. So think of the laser as a sculpting tool that is invisible, painless, and pretty accurate. You can literally cut an etching into the strand of the hair. Alright? So when you use the laser to sculpt the front of your eye, the cornea, that whole surgical concept is called laser vision surgery. LASIK is one among many laser vision surgeries. Now, laser vision surgeries are among many more refractive surgeries, or surgeries to remove glasses and contact lenses. And in addition to that is this super specialty that I've created called corneoplasty, which is how you convert LASIK and LASIK-like surgeries into an art. How do you take Jordan and decide he needs a different kind of surgery? And you may recollect, we went through a lot of Q&A and
why was that different than, say, your normal patient? Like,
your level of astigmatism, the thickness of your cornea, the size of your pupil, the kind of work you do, given how young you are, keeping you free, knowing your brother is also, he's going to be a pilot if you want to be a pilot. So keeping all these things in mind, the doctor should be able to come to a conclusion of this is the technique I want to do for Jordan.
okay.
Here are my reasons, which should be safety-based and long-term, visual outcome-based. So if you see now, you'll realize LASIK is one among laser vision surgeries, which are among refractive surgeries, and corneoplasty can even reverse refractive complications. So the art of selecting surgery to a patient, I think, makes it very unique in that questions must be encouraged from patients to doctors is, Doctor, why are you selecting this surgery for me? Is this all you know? Or do you really truly believe this is the best for me? And is there something coming down the line in the future? Because I'm young, should I wait for surgery? So the doctor should be able to explain all these points and say, this is what I want for you, and it's available now, and yes, we are very confident you'll get a good result.
And, this versus a good friend of mine has had LASIK surgery. He's had to have it twice now because he's gone back and his vision's gotten worse in the long run over time. Here's something that's going to be permanent. You might have to suffer a little more in the short run, but you're going to get the long run results.
Sure. Now, there are various reasons for having to do somebody's surgery. Again, the most common is then when you're not seen by the surgeon in your pre-op, and surgeries are just done, at a pace, if you may. And then when you don't come with the outcome that you needed, you have to tune up, touch up, stuff like that, and correct these patients. There is something else that can happen called regression, meaning no matter in whose hand you have the LASIK procedure, your body tries to reshape that shape. And that can be corrected, so we have left enough tissue if you ever needed it, but knock on wood, we don't have to do that because that's where I believe, at least when I train LASIK surgeons, is spend a lot of time understanding the patient, doing your testings, measuring the patient, because the same adage applies. Measure twice, cut once. The eyes are perfect. So, how do you, let me ask you, Jordan, because my quest is vision better than 2020. Do you perceive your vision, and I'm sure you remember our discussion I had mentioned to you honestly, like I do with everyone, no one can guarantee your outcome. No one can guarantee that you won't have a bad outcome. But yet, when you make a decision based on facts, logic, and a desire to excel, most usually you turn out good. Do you perceive that your vision is better than 2020?
Oh, hands, no questions.
How do you know? Because I can measure with my chart. How do you know?
I can look out this window right now and tell you that I can see better than I've ever seen in my entire life.
Because remember, you were seeing 2020 with your glasses and contacts.
And but the amount of detail is it's just not the same.
Even better than your...
Even better. It's better than that brand new pair of glasses, that brand new pair of contacts. It's pretty undescribable in words.
Excellent. Well, that kind of corroborates what I've seen objectively by testing you, so that's excellent. Anything, Jordan, that I could have done to educate you more, any way that I can improve my patient interaction?
I believe you're the most in-depth as far as asking questions, asking me, making sure that I've done my research, make sure the patient knows what they're getting into, and knowing exactly why they're coming to Dr. Gulani. I don't feel like you could do any better of a job as informing patients. I mean, I'm sure there's always steps to improve, but as far as my comfort level and my knowledge level goes, I know a lot more now than I did going into it. I didn't just come in and get fixed and then get sent on my way. I got a lesson on why my eyes are better now than they were before.
Excellent. Again, congratulations, John.
Thank you
It's been a
very
real
much,
pleasure.
Dr. Gulani.
Happy surfing.
Oh yeah, thank you very much.
Great.